This is Deb Wilkinson from URL Insurance Group, and I'm so happy that you joined us today for the Capital Blue Cross individual program training event. And I know that many of you have had a lot of questions about the Capital Blue Cross individual programs, and I'm really happy that Scott Stewart, the Director of Individual Sales and Producer Relations for Capital Blue Cross, is running the program today. Obviously, many of you have talked to him. He's a wealth of knowledge about his products, and you know, I think that they're going to really fill a niche in the marketplace for us, both on and off the exchange. But first things first is learning what those products are. You can, of course, refer to our website. We have everything loaded. You know, the official term is it's a bit wonky right now and under the product information, but by week's end, we should have everything sorted out that it's easier to understand. And as you might imagine, we have 2013 products and information on our site, as well as the 2014 products. So it gets a little bit confusing, but we're going to try to make it a little bit easier for you, the site, so that you can gather the information that you need. As always, we're here to help. You can contact myself or my staff, your individual case managers. They're either Jessica Kyer at extension 123 or Judy Reed at extension 104. As you may know, they're a wealth of knowledge that you have. So with that, I'm going to turn the program modules, and we will take questions. Obviously, Scott will let me know when he wants to take questions, either during the program or at the end, and we'll hopefully get all of your questions answered. So thanks again, Scott. The floor is yours.
Thank you, Deb. Good morning, everybody. I'm going to turn up the volume here on my little headset. I was told that when I was doing these the last couple of days, the volume was low. So hopefully everybody can hear me. Thanks, everybody, for giving us an hour or so out of your morning. This is a long presentation. I just want to give you fair notice. We'll do our best to keep it within the allotted hour, but if we run over, I will stick around as long as necessary to try and answer questions, and I will make every effort to get us through the deck before the conclusion of the hour. I appreciate Deb's vote of confidence about being a wealth of knowledge. Like many of you, there are still things that I am learning about all of this. This is really a new world, and while we know some things, we continue to learn every day. So hopefully we're able to impart some additional information to everyone that's on the call and on the webinar this morning, and I'll jump in and get going here. So just a quick summary of what we want to talk about. Obviously, we want to talk about the medical plans. There's a whole new nomenclature associated with our plans for 2014, so we'll talk about that and how you can interpret what the plan design is going to be from the name that you see on the plan. Then we'll go into some changes. We'll do some comparison and contrasting between the current medically underwritten plans and the new PPACA compliant. We definitely want to talk about the prescription drug coverage because there's some significant change there. We'll talk about the vision and dental plans that come along with this, what's embedded, what's not. We will talk about where to go to quote these things, how you can estimate subsidies for some of your clients who may be eligible for a premium tax credit subsidy. And then as far as selling the plans, how do you go about doing that? And then obviously everybody's very interested to know what are the commissions going to be on these, and we will get to that as well. I will also send Deb a copy of this deck. Darn it, it does that every time. Sorry, guys. I will send Deb a copy of this deck, and she will be able to send it out. They're going to post this, I believe, on their website. I think we are recording this as well, so if you really want to dial back in and listen to me again, you're able to do that. So
we are recording it. I'm sorry, Scott. We are recording it, and it will be available. I'll send the link out with the newsletter tomorrow, so you don't have to take copious notes. You'll have all the information recorded at your fingertips.
There you go. All right. So we want to introduce to our brokers and to the consumers in the 21 counties Healthy Benefits. That's the name of our new family of plans for the post-healthcare reform era. And you're going to see that name at the front of all the plans. So everything's going to start with the words healthy benefits, and that's going to be included in all products, both on and off the marketplace. The next thing you may see with certain plans is the word value, and that's going to refer to some specific networks that we use in those 8 counties you see on your screen. So in Berks, Cumberland, Dauphin, Lancaster, Lebanon, Lehigh, Northampton, and Perry, if you're quoting somebody a plan on the marketplace, they are going to see a value plan. And we'll talk about more specifics related to those networks in a few slides. The next thing you're going to see in the name is the type of plan. So for instance, in my top example, we've got a healthy benefits value HMO. In the bottom, it's a PPO. So it'll tell you, the type of plan that you're buying. And then the next thing you're going to see is up to 3 numbers. The first number will always be the deductible. So in the top example, it could be $4,000. In the bottom, there's no deductible. The next number is member coinsurance. In the top one, that's 50%. In the bottom, there's no coinsurance. And then finally, if applicable, there's an office visit copay, and this is the PCP level. So in my bottom example, you have 0 deductibles, 0 coinsurance, $50 PCP copay. Then the last thing you're going to see in the name, in some cases, will be the initials PD, and that stands for pediatric dental, and that tells you that there is indeed pediatric dental embedded in those plans. There is pediatric vision in all the plans. So you can assume that when you're selling one of these, pediatric vision is included in all of them. Pediatric dental is included in certain off-marketplace plans only. In all of my on-marketplace plans, and you'll see this again, but in all my on-marketplace plans, there is not pediatric dental embedded. You will need to purchase a standalone pediatric dental plan for anyone with for any dependents under the age of 19 if they're buying a plan on the marketplace. There is still a question outstanding, and we think we know the answer, but we're waiting for confirmation. But there is a question outstanding as to whether everyone age 19 and over, as well as under 19, needs to have pediatric dental included in their plan. So more to come on that. But we do know that if you're under 19, you need to have pediatric dental in your plan for it to be considered a qualified health plan. So if you sell a plan on the marketplace, it's not going to have pediatric dental. You need to have your clients purchase a standalone pediatric dental for those dependents under 19. All right. Sorry, I went backwards there. Okay. So let's get into the actual product portfolio. And just a quick visual of what you're going to see on the marketplace, predominantly HMOs. And the varying for just as a quick refresher, we're covering all of the metal levels except platinum. I don't have any platinum offering either on or off the marketplace, but I start with catastrophic, and these numbers here refer to actuarial value. That's what the AV stands for, and what it means is that it corresponds, or it means that the plan should cover about, in the case of my bronze plans, it should cover about 60% of the expenses that you would incur if you buy a bronze level plan. So a silver plan should cover about 70%, and a gold should cover about 80%. It does not index to coinsurance because, as you will see, I've got silver plans with 50% coinsurance. And so don't equate coinsurance levels with metal levels at all. It's more about the whole package that you're buying and the percentage of expenses that the plan covers. And that's probably the best way to explain it to your clients. So on marketplace, predominantly HMOs. I do have a silver PPO and a gold PPO. And then off marketplace, HMOs at the catastrophic level, and then PPOs for the rest of the levels for bronze, silver, and gold. So let's talk about the HMOs first, because these are the newest. This is the first time we've had an individual HMO. These are available mainly on the FFM, or the federally facilitated marketplace, as it's known. And you saw in my last slide that the only HMO off the marketplace is my catastrophic plan. And so what plans you're offered or eligible for is determined by your primary county of residence. So we need to know what county you're in. And you saw earlier I've got 8 counties where that value HMO network is in play, but I also have a 21 county HMO service area. And here's a graphic so you can see those counties. The rates on those plans on the value HMO run anywhere from 18 to 25% less than comparable PPO products. So there is a significant premium difference because we're trying to drive to a premium, a particular price point here. So when we did our research into the market and the people who would be coming into the healthcare market as a result of of PPACA, price was the absolute most important thing to the people, the new consumers in the healthcare market. And so when we went to build products, we tried to build them with that in mind. So to purchase a value HMO plan, you must reside in one of the 8 counties that was in my previous slide, the shaded counties, and you have to get services from providers located within those counties. If you go outside those 8 counties, you only have urgent and emergency care covered. Otherwise, there's no coverage. So you're using the providers inside those counties. If you go outside our 21 county area, though, you do have away from home care and Blue Card available. And then the question comes about, well, who's in and who's not in the network. So it's probably easier to show who's not in the network. So you can see here the list of hospitals and the related physicians that do not participate in the 8 county, the value HMO. And like I said, you don't have to scribble down notes. You're going to get a copy of this so you'll know who is not in the network. So as far as products go, our gold HMO, we have one gold HMO on the marketplace. It has a $500 deductible, no coinsurance. You can see my office visit copays here. There's no prescription drug deductible. And then this out-of-pocket max for single and family, you're going to see the same numbers in all my slides because this doesn't change. These are federally mandated numbers. Those are the maximum amounts that a member can spend on out-of-pocket. And by the way, they include things like deductibles, coinsurance, copays, prescription drug deductibles and copays if applicable. They include urgent and emergency care copays. They include pediatric vision and dental. So everything goes into this bucket. It's a big change from what we used to know as our out-of-pocket maximum. And in one of my later slides, I reinforce that point. But it's important to note that there's a lot more going into this now than there was in the past. And again, these numbers will not change. You'll see them on every slide. I have 3 silver HMO options. Deductibles vary from 0, as you can see in here, to and above it, to $2,500. So again, and you can see there's different ways to skin this cat because up here I've got a 0 deductible with 50% coinsurance. Here I have a 0 deductible with no coinsurance, but instead I apply PCP and specialist copays. I apply a significant prescription drug deductible. So for instance, here you have somebody who's concerned about paying for doctor visits. They don't anticipate an inpatient stay. Maybe their kids use prescription drugs. You know, they've got some young kids and they're worried about prescription drug costs, so maybe this is a better plan for them. This person doesn't use a lot of prescription drugs, but they don't want to have any big upfront costs. This person isn't worried about having a deductible up front because they frankly don't use it that much, and they're okay with having a $2,500 deductible. So some different approaches, again, all in that 70% actuarial value in a silver plan. So then at the bronze level, I have 2 HMOs, a $4,000 and a $6,000 HMO, one with 50% coinsurance, one with no coinsurance, no prescription drug deductible on either one. And again, here at the top, you can see, you know, somebody who doesn't use the plan much, they just want to make sure, you know, if I go to the PCP, I want that covered in full. I want to pay a copay for that, but I probably am not going to use it much. There you go. If somebody doesn't mind having a bigger deductible, and again, $50 PCP copay, you've got the $6,000 deductible there. And then the catastrophic option, this plan is only available to folks age 30 and under or who have certain financial needs. And the financial needs are determined solely on the FFM. I do not have a definitive set of guidelines for what those financial needs are. In fact, when I spoke to my actuary, who has been in touch directly with CMS, even he could not get specifics around this. So if somebody truly wants this and they feel they're eligible for it, they're going to have to go out on the FFM. I believe you have to file an appeal with CMS to get this, and there's a lot of work that you do, it sounds like, to get this if you're over the age of 30. But suffice it to say, this is my catastrophic plan. It's got a less than 60% actuarial value. And again, this is aimed primarily at the young and healthy, the invincibles, the folks who, frankly, might not otherwise even consider buying a health care plan, but they have to have it, so here's an option for them. And then HMOs off the marketplace. Again, this one mirrors my on-marketplace as my catastrophic option. So again, same deductibles, co-pays, co-insurance, everything the same. And this is the only HMO product that we offer off the marketplace, and it covers our full 21 counties. We don't have a catastrophic value HMO offering. So if somebody's buying an HMO in one of those value counties, if they're buying it on the marketplace or off, they're going to get this one. There's no value plan. So then the PPO products look like this. and remember, we had one gold and one silver on the marketplace. So I have a $1,000 deductible. My copays are $30 and $50. There's no coinsurance, prescription drug deductibles of $100 and $200. There's my consistent out-of-pocket max, and then ER of $275. And then my silver is a $6,000 deductible. You can see the copays. The out-of-pocket max, again, stays the same. Then my off-marketplace, I have 5 gold PPO options. Deductibles range from $0 to $3,000. You can see that I have one version here with the PD at the end. That tells you there's pediatric dental embedded in this. Again, the reminder, if you're selling a plan on the marketplace, I don't have pediatric dental. You need to make sure anybody under the age of 18 gets pediatric dental if they buy that marketplace plan. So again, deductibles here from $0 to $3,000. And again, depending on what sort of cost structures folks are willing to incur up front, what kind of premium they may be looking for, we offer some different ways to approach this. Silver options, I have 2. One with pediatric dental, again, 0 deductible, 0 coinsurance, $50 copay. This one's a $6,000 with no coinsurance. And then bronze options, I've had some inquiries from folks about HSAs, and here are my HSA options. I have a $6,000 and a $4,000 HSA plan available. You can see on my $6,000 one, everything pretty much goes to deductible. There's no coinsurance. On my $4,000 one, I've got 50% coinsurance. So a quick summary of the plans on the marketplace. There is no platinum, and there's no platinum off. I have 2 gold, one's an HMO, one is a PPO. I have 4 silver plans, 3 are HMOs, 1 is a PPO. 2 bronze, both HMO, and 1 catastrophic, which is an HMO. We did not embed pediatric dental in any of these. So again, the reminder, sell your client the pediatric dental for anyone under 19. However, pediatric vision is always embedded. So there is pediatric vision, and it does all of the copays, deductible, coinsurance, prescription deductible, pediatric vision or dental, everything goes to the out-of-pocket max. And then off-marketplace, again, no platinum, 5 gold PPOs, 2 silver PPOs, 2 bronze PPOs, and again, there was pediatric dental embedded in one of the gold and one of the silver PPOs here. and then one catastrophic HMO off marketplace. And as it says, dental's embedded in one of the gold and one of the silver, and again, pediatric vision in all of these. So to move on and compare and contrast from the world we know to the world we're moving into, let's talk about some of the differences. And I've been kind of hammering away at this first one, the out-of-pocket max. There's now a lot more that goes toward this. Typically, in the past, that was always the amount of coinsurance that somebody paid on a plan. But now it includes not only the coinsurance, but as it says there, deductibles, copays, coinsurance for everything, not just medical, but prescription, pediatric, dental, and vision. So it's all into that out-of-pocket max, and that's the $6,350 or the $12,700 that you saw in my previous slides. We differentiate between where you get your labs done now in terms of whether or not you pay a copay. If you use an independent lab, then there's no copay, but if you go to a facility or hospital-owned lab to have a blood draw done, there's going to be a copay associated with that, those lab services. Therapy. In the past, we had some separate visit limits for things like PT, OT, and ST. We now have combined those visit limits, in particular for PT and OT, but it also includes rehabilitative and habilitative therapy, so an expansion of that benefit. Probably the two biggest changes are these first two, maternity and mental health and substance abuse. Maternity was not covered in any of the medically underwritten plans. As everybody's aware, it is included in all of these plans. And the same with inpatient or outpatient mental health and substance abuse. Again, it was not covered in the medically underwritten plans. It is included in all of these. I did get a couple of emails from some folks about the level of benefit under the mental health and substance abuse. As you can see from the slides before where I'm describing the plans, it's going to vary. It is a covered benefit, but it is going to vary based on the plan that somebody picks. There could be coinsurance involved. There may not be. Maybe there's a copay if it's a special, since it's considered a specialty. So it's going to depend on the plan they choose as to how those things get covered. In the past, pediatric dental was never covered. It was embedded again in some of the products. You saw the silver and gold PPO off marketplace plans. Pediatric vision, again, it's always embedded. Dollar limits. There are a lot of dollar limits that are removed. There is no lifetime max on any of these plans in total, so total benefits cannot have a lifetime maximum on them. But for instance, some significant ones from the past, hospice, DME, and DME, there's no dollar limits now on those. And then I think everyone's pretty aware of this, but it doesn't hurt to reinforce it. The open enrollment period for these started on October 1st, and the first one runs for 6 months through March 31st of 2014. Next year, it will only be 3 months long, coinciding, fortunately or unfortunately, with Medicare, but it does. So the first one is for 6 months. To enroll for and one of the good things, I should slow down, I'm getting ahead of myself here, but one of the good things is we now know that effective dates for these plans at least will always be the first of the month. And your enrollment has to be into the carrier by the 15th of the month prior. So for all the enrollment that's going to take place for January 1, it's got to be into the carriers by the 15th of December, or it will jump to the 1st of February. So you'll be able to tell your clients definitively, there will be no guessing about it, that they need to have their enrollment in, or we need to get this application in by the 15th of this month if you want to be effective the 1st of next month. Otherwise, it's going to go a month ahead. So we're going to enroll up to and including December 15 for January 1, 2014 effectives. And then because there's now an open enrollment period, it begs the question, well, what happens if somebody loses a job during the year? Let's say they have coverage through their employer, or what if they get married, or what if they have a child? So those are what we call special enrollment periods. That period lasts for 60 days from whatever the event was that would have triggered you to need to add someone or drop someone from coverage. And you can see some of the examples there on the screen. For instance, the first one, loss of minimum essential coverage. That's losing your benefits that you may have had through an employer or another plan. That qualifies you to go out and buy another plan. Moving to another state where the plan you have now is no longer valid. If you need to terminate that coverage, you're able to re-up in the new state to which you move. So this is only a partial list. There is a more extensive and more detailed list out on the CMS website, but these were some of the bigger ones, that the higher points that we thought were worth noting. And then one of the topics that is probably on the tip of everyone's tongue is, well, what are subsidies? I get a lot of questions about subsidies. How do we calculate them? Where do we figure them out? How do we administer them? Can we do it? The answer is yes. There are any number of tools available on the website or out on the web right now. We are currently redirecting you from our website to the Kaiser Foundation tool. That one's been out there probably the longest of anybody's. We're in the process of reworking our tool to reflect our own rates. Now that our rates are in the market, we thought it would be a good idea to take our calculator and actually put our real rates into it, so that what we're giving is a real-world example of what the subsidy would be and what it would be worth, excuse me, if someone's buying a plan from us. But subsidies are available, just to quickly review. Subsidies are available for folks between the ages of 100%, or I'm sorry, between 100% and 400% of the federal poverty level. And we actually had a public affairs forum here this morning at our office, and it was confirmed to us because there's some question about folks who are potentially eligible for Medicaid and how that works in the state of Pennsylvania. But the subsidies will go down to 100% of federal poverty level. We were able to confirm that this morning. So anybody that's between 100% and 400% of the federal poverty level could be eligible for a subsidy. The only place you can use a subsidy, though, is on the marketplace, because you have to go out to the marketplace, you have to attest to your income level, and then verify the amount of subsidy that you may be eligible for. And again, we aren't able to determine what someone's subsidy is. That's up to the federal government. It's based on their household income, as it says here, and family size. And one note on subsidies. Depending on your client's circumstances, they may want to waive part or even all of their subsidy, because you do not have to use them up front. You can save them and take them at the end of the year when you file your taxes. And one of the times when that might be prudent, or to perhaps not use all of it, is if someone knows their income may be increasing during the year. Because if I am at a lower income level when I attest to my subsidy, and then I go through the year and my income increases, and I file my taxes and I have moved out of that subsidy bracket, but I used all the subsidy, I could end up owing the government money back. Now my understanding is that there is a process during which if in the middle of the year you see that your income is changing dramatically, you can go back out and reattest to it. But it may be prudent. Not everybody's going to remember to do that. So it may be prudent to not use all the subsidy, and that's something to keep in mind when you're talking to clients. So then and I hate to say this, but to further muddy the waters, there are also cost share reduction plan varieties, if you will, within for the different subsidy levels. So for instance, if someone is between 200 and 250% of federal poverty level, they are eligible for the 73% cost share reduction. So it's actually, if they're buying a silver plan, we already know that they have a 70% actuarial value. Well, if you're between 200 and 250% of federal poverty level, you can actually get an additional 3% actuarial value in your favor, and you can buy one of what we'll call the 73% plans. If you're between 150 and 200% of federal poverty level, your actuarial value bumps to 87%, and if you're between 100 and 150% of FPL, then your actuarial value bumps to 94%. So what they're trying to do is offset the potential for out-of-pocket costs for folks who make less money. Now, the folks at those lower FPL levels are obviously getting a greater subsidy, and you can anticipate that the premium on these plans, because they have a higher actuarial value, is going to increase as well. So the intent is we get them a better level of benefit so that they can use the subsidy and incur lower out-of-pocket costs. And then the zero cost sharing and limited cost sharing, those go across all metal levels, and that is basically only for Native Americans who are above or below 300% of FPL. So not sure many of us will encounter any scenarios, but we put it in there so that everybody was aware of all the cost sharing variations that are available out there. I'm going to click through this really quickly. The OPM project, if you will, I'm not sure how much of a value prop there is for all of us this year. These are two plans that are available only on the marketplace. We are not marketing them directly, so they don't appear off the marketplace. These are in conjunction with a project that was started through the Office of Personnel Management, which is basically the Human Resources Department for the federal government. The Blue Cross Blue Shield Association wanted all of its plans to participate, so we are. And the idea is to eventually get this to where there is a homogeneous plan offered by every Blue Cross Blue Shield plan across the country, so that if you're in Pennsylvania and you buy this plan, it looks the same as the plan you buy in Florida or the plan you buy in Texas or Colorado or Utah. It does not look that way this year. I don't know how many folks will go here, but they're out there if you get somebody that wants to buy one, because, again, the idea is to move this towards a very homogeneous, uniform plan design across all of the participating multi-state carriers. And then here's a screenshot with my two different plans. So I have a gold and a silver. These are offered only on the marketplace. And they're both HMOs. All right, before I launch into prescription drug, I'm going to pause and ask Deb how the question meter is looking. Do you want to wait till the end, or do you want to stop and try to answer some questions now? We're at about halfway through the hour.
We have quite a few questions, so I would say that we might want to take a few, if that works for you.
All right. All right.
First one comes from Rob. He's noticed that the CBC rates are a good deal higher than Highmark for 2014. Not really a question, maybe just a statement.
Yep, I agree. I understand that. One of the things that everybody should know, and I mean, if you weren't aware, we had no way of knowing what anybody else was doing in the market. Everybody was working somewhat blind when we did this, and we filed what we thought we were not conservative as to our way of understanding. Obviously, we were more conservative than our counterparts there. So yeah, I understand that, and this is the first shot out of the cannon for everybody, and I think it will be interesting to see how that plays out in the marketplace. But yes, I'm very well aware of that, and we'll be watching that closely.
And just to make mention, for the highly subsidized folks out there, your clients, even though the subsidy is based off the second lowest silver plan, for the free is free is what I'm trying to say. So for the highly subsidized people, CAP might have a better plan design. So it's not a total wash for sure.
Right.
There is a question from Margie about group capital, about the pediatric dental included in all of the CAP Blue Cross plans. And Margie, I'm not sure about that, but I'm going to do a takeaway and check on that for the pediatric dental. My feeling is yes, but I will confirm that.
I'm guessing it's probably only the shop plans, Deb. I don't know about the others, the normal small group and things like that, but my guess is if it's it might only be the shop plans, but I'll let you.
Okay. All right, yeah, that's my feeling as well, but we'll check into that. And there's another question, who is in the value network, and can you, the list is probably too long.
I was going to say the list is pretty big. I'll do that as a takeaway and see if we can get a more definitive listing of who is the value network. I think that's a good question, and we're at my deck. I didn't build the deck, truth be told, but we're at mine. I probably would have approached it a little differently, but we'll see if we can't get everybody a list, and I'll try to publish it out. If I don't, I may not have it in time. I'll send the deck to you, Deb, but what I'll do is I'll make sure that I get that at some point, and then we can publish it out and let everybody know who is in the value network. That's a good question.
Perfect. Sue says that she may have missed this, but she wants to check if there's marketing materials available and how we would order them.
Okay. Marketing materials are coming. Our SBCs are finally done. There was a number of changes that were made. They kept coming back and requesting changes to the SBCs, so those are finally done. What we're doing now is tagging them with names. There's a really long, literally digital name attached to each SBC right now based on the way CMS builds the form. They mean nothing to you when you look at them. So we need to name all of them and then place them out on the website. So yeah, that's all coming, and you'll have some detail here on that fairly soon. The best source of information right now, and I realize I've directed a couple of people here and I've gotten some feedback that, this doesn't show us a lot of detail, and I understand that, but the best source of information is we have a consumer site. It's choosecapitalblue.com, and you can click through, I think it's 2 screens, and then you can pull up some high-level information on the various plans. I realize, again, that it's not as detailed as we would like, but it's the best I have at the moment. So more to come on the SBCs. We'll have those hopefully posted on the website here very soon.
And thanks, Scott. But there's another question about coinsurance. 100% means no coinsurance means claims are paid at 100%, and I would say maybe it
could be subject to the deductible first. I mean that.
Well, yeah, certainly for the deductible, and also even if the deductible is met, if they have not met that single or family out-of-pocket max, that
right.
Yeah.
Yep.
So hope that answers your question. And they're looking for a drug formulary for January 14. Do you know if that's available on the site?
It'll be on the site. I'm going to talk about that here in a minute because it's a different formulary than what we've used in the past. But yeah, we will get that up on the site. I don't know that it's up there now. Again, with the approval, and that was one of the things here, is that we were all held. Everything was held under wraps until October 1st, and so until everything was approved and available to put into the market, we didn't necessarily have everything that we wanted. So we're in the process of creating things. But yes, it would be my understanding that we'll have a copy of the formulary available at some point. But I'll talk about that in a couple slides.
Okay. And Sue's asking about the quoting. She's saying, is it going to be on the producer page under personal PPO? And she was on the...
Also getting to that in a few slides.
Okay.
Talk about that shortly.
Is there a waiting period for maternity? If a client is pregnant when they join the plan in January, will Capital take her?
Yep, we have to. All that goes away. Medical underwriting is gone for these plans, so we have to take anyone that comes to us as long as they complete our app and pay us a premium. All of these plans are guaranteed issue, and there is no pre-existing condition whatsoever. It's not allowed.
Okay. There's a question about COBRA, if COBRA will continue, and absolutely. An employer plan is different than a single plan, and the offerings of COBRA are still, that has not changed. If a person's income changes and becomes higher due to a possibly new job or other circumstances, does this have to be reported, and will it change in the middle of the year? It does have to be reported, and there would have to be some sort of allotment or change in the subsidy.
Yep.
How that actually takes place, I'm not sure yet. Question from Sean, can applications be taken online and or remotely with an e-signature?
It depends on your interpretation of that. If you're asking for a straight-up web application, I don't have that. As you'll see, and I'll talk about how to sell the products, for off-marketplace, I have a fillable PDF that you can complete with a client and have them sign, and then you can send that to it. You can email that directly to us. There's actually a submit function built right into the PDF that sends it straight to us. But for on-marketplace, that all has to take place right on the FFM. Of course, with the FFM not necessarily working at full capacity right now, some folks are resorting to, initially, it's the paper subsidy app. We're in the process of trying to figure out how that would work if somebody fills out a paper app. And if we don't have, if they fill out a paper subsidy app and that comes back, and then they want to actually go back out on and buy a product, if we don't have the FFM available, what's the application look like for the actual product itself, and how does that work? So more to come on that, because I'm hoping we don't have to go there, but there may be a paper workaround. I'm not aware of anyone right now who has a pure online web application available for the marketplace, because nobody has been able to test, not us or any other carrier or even any of the web-based entities who are working with the feds. I'm not aware that anyone has been able to test the connectivity back and forth with the FFM, and as such, until you can do that, you're not going to want to be sending a lot of PHI back and forth until you're sure that everything is working properly. So it's unfortunate. It's creating a huge backlog for a lot of folks, but that's got to take place before any of us can do business completely via the web with this.
Exactly, and that goes right into the next question. Pardon me, it's a rather long question, so I'm going to paraphrase, but essentially it has to do with the FFM not being functioning and what that means for a paper application, if paper applications are being recommended, you know, as far as securing an effective date. And Rod, I can tell you that I was on the line yesterday with the Health Insurance Marketplace. Scott and I have talked about it. We're still trying to figure out what that process will even look like and what that means as far as securing an effective date. What I have learned is that if the paper app is sent in, it is marked as being received, it's processed, and whatever that process means or however long that takes, bottom line, if payment is received at the carrier by the 15th of December, then after the plans have been chosen, then the 1/1 effective date has, pardon me, has been secured. But again, until we really can see this process, I'm not recommending paper apps at this point.
Sorry, and I had muted my phone. I was taking a drink of water. I agree, and I sent an email late last night asking, you know, I want us to start working on that so that we can get some talking points out to folks, and if possible, you know, if we can nail down the process and send the forms out, we will certainly do that because I know, you know, there's a lot of people getting antsy right now.
And I'm actually working with one of my agent partners in a quick little pilot program, taking a paper app and following it through a paper submission and seeing what that means, and following it through URL, inputting that information into the FFM. So I should have more information on that soon. There's a question here from Rod Scott about the AVs for the various plans.
Yep.
And how you come up with the AV, if it's the number of enrollees expected based on your current enrollment, claim experience, etc. Do you happen to know?
It's a very long, complicated formula, and honestly, I don't have it. I'm sure you can get it from CMS if you really want to go out and dig into that, but in all honesty, there was a lot of discussion, a lot of back and forth about, okay, so what is actuarial value and how do you calculate it, and it's long and complicated. But that's the best answer I can give you.
All right, and that ends the questions for now.
Okay. All right, so let's talk about prescription drugs and how they're going to work in the new post-reform world. So you heard me say there's a new formulary going in, and it is going to be what we call a selectively closed formulary, which means that if your client is going to use a non-preferred brand medication, it's going to be limited to certain therapy classes. We're going to exclude multi-source brand drugs from this, and most non-preferred brands will be excluded. So we're going to be looking at people to limit their drug use. The ones they use, we're going to want them to choose from the preferred brand listing. Again, we're driving to a price point here because all the data we've seen on the people that are coming into this market, the folks who are going to be buying coverage, price is king. There is a non-formulary consideration process if somebody needs to use a non-preferred brand based on medical necessity. There's a process in place for them to appeal and get use, be able to have access to that particular medication. But the vast majority of folks will need to work within the selectively closed formulary. And I should say that I'm not going to go through it, but at the end of this deck there is an appendix that will give you a window into how that's going to work, and it will give some examples and what that looks like, and that will come along with the deck. So those of you that are forming questions in your minds, okay, so what do you mean about this selectively closed formulary? There's examples of it here that are at the end of the deck. I'm just not going to probably have time to go through all of them, so I'm going to leave that for you to read once we send the deck out. So comparing and contrasting on the prescription drug side between current and new products. Currently, you had a choice. You could do a mail order, or people could fill maintenance meds and they could get 90-day supplies at retail. In the new world, if you're buying 90-day supplies, we'll give you an original and one refill at pharmacy, and then you've got to use the mail service if you want to fill that. You're not going to be able to just keep going back to the pharmacy to buy 90-day refills. And there is a mail order cost share, obviously, for those 90-day supplies. In the current products, we use CuraScript's preferred formulary for specialty pharmacy. In the future, and you could get those at retail as well. In the future, any specialty drug dispensing, you must go through CuraScript. There is no retail fills on specialty pharmacy. Claims, anybody that files a paper claim has to file it within 90 days from the date they receive service. So if somebody is seeking reimbursement and they're filing a paper claim, they need to do it within 90 days. And then finally, the replacement meds. In today's world, anything that gets lost, stolen, damaged, etc., that's covered. That coverage goes away in the new world. So if somebody loses their meds, they're going to end up paying whatever the pharmacy's price is to replace them. We are not covering those, and they don't get them at there's no discount applied to that. Some other changes, enhancements, highlights, whatever. In the current world, mandatory generic substitution. In the future, if somebody chooses brand over generic, then there's going to be a penalty that gets applied, and those penalties don't go to maximum out of pocket. Those are separate and distinct and over and above. One of the things that was eliminated or changed is the 12 brand fill limit. There is no brand fill limit now in any of these products. On the HMO plans, you need to use participating pharmacies. There's no coverage if you go to an out-of-network pharmacy or a non-participating pharmacy, and you would have to appeal they would have to appeal any claims that were made at out-of-network pharmacies. On the PPO side of things, they may be able to use non-participating pharmacies, but again, it's going to depend on your benefit, as it says here. There could be separate drug deductibles. It could impact your maximum out of pocket. And then I referred to the penalties, the ancillary charges that could be incurred if somebody chooses, say, brand over generic when generic's available. Those, as I said, don't include or don't accrue to the deductible or maximum out of pocket. Then moving on and going into dental and vision. For the marketplace plans, and I've talked about this, so I'm going to kind of blitz through this. Pediatric vision is always there. It's in all the plans, actually, on and off. Pediatric dental is not embedded. And there are pediatric and family plans that are available. If somebody is looking for a plan off the marketplace, I'm going to skip down to this second big bullet here. This is the link where they can buy it. Those of you that are selling it have your Capital Blue Cross broker links. We've been selling the dental plans. The current products that you have will continue to be available until the end of November of this year, and then on 12/1, all of the 2014 products go up for sale. And those will be out there available on your websites. So the pediatric vision, just to give you a quick overview of the benefits, and again, this is embedded in all the plans, all the medical plans we talked about earlier. You'll see these pediatric vision benefits are available, and they're in place for kids under the age of 19. There's one exam per year, covered in full, up to the $32 allowance. One pair of eyeglass lenses, you can see the allowances there. One pair of frames, up to $30 allowance. And again, there is a network associated with this plan. As part of your website, you're able to look up providers for this. The networks are pretty good for these products. It was very gratifying when we roll these out to do some spot checking of the networks and see that the provider network is fairly robust for these. Excuse me. So it's worth a couple minutes of your time or your client's time to check and make sure that they're vision providers in the network. The dental, the embedded pediatric, again, it's for children under age 19. You can put an asterisk there because there's still that outstanding question of, well, if we're 19 or over, do we have to buy this as well? And that's the thing we're trying to get clarification on. Again, it's not embedded in our marketplace plans. So if somebody is buying our silver PPO plan, here's the pediatric dental benefit. And these are in and out of network benefits all the way down. So you can see that preventive exams are covered in full, and then basic services covered at 60%, major at 60%, orthodontia is covered at 50%. There is a 24-month waiting period on orthodontia. There's a $110 deductible. And then, again, all this accrues to the medical out-of-pocket max. No annual program and no lifetime ortho max. On the gold plan, again, the preventive is covered in full. Lower levels of coinsurance covered, again, with deductible is lower and covered combined with the medical out-of-pocket max and no maximum for annual or lifetime. So our portfolio, our portfolio looks like this for pediatric only and family coverage plans, as well as dental HMO. On the marketplace, we've got the PPO pediatric and then the dental PPO plan 1. If you're familiar with the plan 1 that you're currently selling, that's the same one. And then you're going to see, I'll show you the benefits for the pediatric 702XS and the dental HMO basic. Off marketplace, dental PPO pediatric again. Plan 1, 2, and 3, those you're currently selling, as well as the dental HMO pediatric, and I'll show you benefits for these, as well as the HMO basic in a couple of slides here. And then off marketplace, again, the pediatric plan 1, 2, and 3, the HMO pediatric 702, the HMO basic, and then those of you that are currently selling vision and dental with us, the discount and the vision plan, these are the same vision and the same dental discount and vision plan that you have now. No change there. So our pediatric benefits, here's the pediatric 702, and there are copays, and it will be in the marketing materials when they come out, but there will be specific copays associated with each of these services. Those of you that are selling, for instance, the Dental HMO Now or the discount program, in the brochure it has a fairly exhaustive list of the copays associated with these different services. It'll be the same type of thing. And then on the PPO pediatric, preventive's covered in full, and then coinsurance, $75 deductible, and there is a total out-of-pocket max of $700 per person, up to 14 per family. So maximum of 2. And that's the end of my dental section. Deb, do we want to pause and take any questions that might have come up before this is going to talk about some letters and things that have gone out and how we're renewing current products. We're about 4 minutes in front of the hour. How are we doing?
We're good. We only have two additional questions from where we left off.
Okay.
The one is an easy one. Margie asked the question and she didn't hear the answer because she had to take a call. It was to do with 100% no coinsurance, meaning that claims are paid at 100%. And
right.
Margie, what that means is that your deductible would have to be met, the subsequent out-of-pocket would have to be met through co-pays or a variety of ways, and then once your out-of-pocket is met, then it would be 100%, but not until that out-of-pocket. Sue asks the question, will there, similar to Medicare, be at least 1 or 2 drugs for each condition that will be on your formulary?
I haven't seen the formulary, so I can't answer that directly. I would assume so, but I can't say for sure.
And the last question, can we sell anyone the dental products adult? And that answer is yes.
Yes, there is no age limit on the dental. You can sell that to your seniors if you wish. You can sell, and that applies to current product as well. You can sell that to seniors. You can sell child only. That's available to anybody. There's no restrictions on that.
All right, and that's it.
Okay. All right, so some heads up. Guaranteed issue products. Many folks I think are familiar with, and I've helped some folks facilitate sales of this product to some of your clients who didn't qualify for medically underwritten. But we have a number of guaranteed issue products that are currently in the market, and these all go away as of the end of December of this year. So these folks all need to find other coverage prior to that happening, or find coverage that starts on January 1. Probably the best known one of this group is the comprehensive. The traditional plan we haven't marketed for, I want to say, at least a year, if not more. Special care is a combination state and federally funded plan, and then the HMO conversion is something that is handled strictly internally. So all of these folks got a copy of this letter that said, hey, your coverage is going to end and you need to buy new health care. So many of these folks may be reaching out to some of you, asking you for help to find them a plan. You can, of course, talk to them about the 2014 plans and show them that. But I would point out that we are still selling our medically underwritten plan through effective dates of December 15 of this year. I just did release some information regarding our medical underwriting guidelines and some, let's say, enhancement of our medical underwriting guidelines. We're reducing the number of times, or we've increased the age when we request someone to get a physical from 50 to 55, and we've also increased the time from which they've last seen a physician or had a doctor visit from 2 years to 3 years. So hopefully we're able to make some more offers and process some more apps there. We're also working to cut the number of requests for medical records in half. And finally, on the medically underwritten side, we will continue to process an app. In our current process, or previously, if we got a family app and one of the parents was denied, we would stop processing on the app. We would stop underwriting on the app until we were told to move forward. We will now continue to process the app and make an offer, if at all possible, on the balance of the contract. So some real opportunity there, and I would encourage anybody that has a client that comes to them who's on one of the guarantee issue plans to screen them for the medically underwritten plan, because you may be able to provide them with some real value there. If you don't feel that they're going to pass underwriting and they're not going to make it through the be able to sign up for a medically underwritten plan, then please, by all means, walk them across the hall and show them the PPACA products and talk to them about that. But this is a copy of the letter that went out explaining, your coverage is ending. You can call us for, here's the address for the healthcare.gov marketplace, et cetera, et cetera. Then on the personal blue PPO side, which is the medically underwritten, which is what most of you have been selling, we also released a letter to them, and this is a copy of that letter. And basically, it says, hey, thanks for choosing Capital Blue Cross. You don't need to do anything. We want to encourage these folks to stay on personal blue as long as possible. We did file for the renewal in 2014 to take place as of, depending on your perspective, November 30th or December 1st. So basically the letter says, hey, you have this coverage. You can keep it through November 30th of 2014. By the way, you're going to see a small premium increase on January 1st of 2014 because you move up one age band, so everybody gets 1 year older with us on January 1st. So they will see a minor increase in premium. We attached to this letter a copy of the execution page with the new premium, so everybody's aware of what their premium is going to be on January 1st. And these went out during the week of September 16th. So no filed increase. The rates are basically the same. It's just that everybody moves up one notch on the age band, and so they will see their premium bump ever so slightly as a result. And I'm told that the range of increase is anywhere between 0.2% and 6%, depends on what underwriting tier you're in. And then the last bullet there, you can still add dependents. So we'll still do business as usual on these contracts. If it's an existing contract in 2014 and somebody needs to add a dependent, if they need to drop a spouse, whatever, they can do that. We'll continue to handle those kinds of contract changes as per normal. And then some reminders and things you should know about. And this is where we're going to get into quoting and selling and things like that. Those of you that have been on our broker portal and been logging in and using our broker portal to enter apps, this is where you can go to run quotes for our products. This is where we're housing our off-marketplace, or as it says there, off-exchange application. And this is where our subsidy estimator is. It's all on the same page. And if you go into the producer portal and you go to Producer Tools, the very first link on the Producer Tools page says Producer Tools Home. And if you click that, you're going to see this. This is the top of the page where it says Helping You Sell Affordable Health Insurance. The first link is to some reform training that's out there that you can look at. Right below that, though, are two quick quote links that take you to a quote engine for either on the marketplace products or off marketplace products. And when you click one of these, it's going to pull up, it's going to open another screen, it's going to ask for some basic information, the last name of the person you're quoting. It'll ask for dates of birth. It'll ask for the county that you're in, because it's going to, the products are offered based on the county of residence. And then once you click put in all the information and hit submit, it'll give you rates for the products that are offered in that county. I'm also working on an Excel version of this that will work much like the rate calculator that we sent out on the medically underwritten earlier this year. And as soon as we can get that, we're in the process of QCing that to make sure that it works properly. We need to add the appropriate verbiage and logos and get it approved. But once we have that, we'll send that out as well. That'll be a little more portable. You won't have to go onto the broker portal. You can save that to your desktop or your laptop and carry it with you and be able to run quotes remotely with that. If someone is going to buy off the marketplace, this is the place for that application. This link pulls up a fillable PDF that you and your client can sit together and fill out, or you can do it on the phone with them. I would encourage you, if you do a phone app for this, that you save it and send them a copy, because at the end of this application, after you've completed it, there is a submit button that when you hit submit, it will send the app directly to our account administration area, and they will enroll that person. Now, you need to let everybody know that if they're buying coverage for January 1, we're not going to process ID cards and member materials and things like that until sometime after December 1st. We're not going to send all that stuff out now. It'll get lost, and I think oftentimes people get an ID card and they get confused and they try to use it right away. So to avoid that, we will take the apps, we will we will enroll them, but we have already put logic in the system that says don't generate any member materials until after December 1st. And then last but not least on this page, right below the off exchange app, is the link to the subsidy calculator, or the subsidy estimator, I should say. And as I said, if you click on this now, it's going to redirect you out to the Kaiser Foundation tool, because our estimator is being retooled to include our actual rates. So once we put that back up, you'll be able to go out there and see our actual premium rates versus the estimated subsidy for the folks that you're working with or talking to. But in the meantime, it's going to send you to the Kaiser Foundation tool, which has been out there for a long time. It's well known. It works great. Please use that. And then finally, and this is the last slide of my deck, and the question I've probably been asked the most is, what's the commission going to be on these products? Well, for all of our standard producers, our street commission is going to be 6% of premium for the life of the contract, and that's level. That is on total billed premium. So even if they're using a subsidy, we're still paying on the total premium. We've done that for a couple of reasons. Administratively, I think it makes the most sense, and it allows the actual amount of the commission to index to the product and contract type. So it will be, as I said, it's 6% of premium for the life of the contract. And that, oh, sorry, I'm wrong. Somebody asked about marketing materials. One of the things that we're sort of in moving to this the new world of healthcare, we're also moving to a new document to describe our plans. We will be using the Summary of Benefits and Coverage, or SBC as it's referred to here. Many of us have used highlight sheets in the past, but with the mandate that we provide SBCs for these plans, we would rather avoid doing duplicative work, because the information that's on the highlight sheet is the same as is on the SBC. And the SBCs do index much better to the new plans than they did to the current medically underwritten plans. The language, the examples, et cetera, that were in these as dictated to us did not work well with the medically underwritten world, but they do work well in the post-reform world. So we're going to be using SBCs. And as I said, we've got them done. We're in the process of giving them a naming convention like this, because right now there's no names associated with these. If you can see my cursor moving, this one says Healthy Benefits PPO 0010. So that tells me that there's 0 deductible, 0 coinsurance, and a $10 office visit, and I'm looking at a PPO plan. The naming convention that's on them right now is nothing like that, and you can't differentiate which plan you're looking at until you open it up and scroll through it. So once we get that finished and once we get them all named, we'll post them on the website and you'll have access to them. Everybody is going to get a new ID card. We changed our logo earlier this year. We eliminated the word cross, and instead we have the BlueCross there. We've also updated the color and the font, so everybody gets a new ID card with the new logo on it. And there is also a new customer service number dedicated to individuals. So when calls come in on this number, the customer service reps handling the call know that this is an individual member. In the past, the calls were going to our general customer service area. We wanted to, because of the focus on individual coverage and consumerism in the market, we now have a dedicated unit for individual customers. I think, there it is. That's the last slide. So we will go back to Deb. Questions? I know there's probably some people that have had to drop off because we've now gone almost 10 minutes past the hour. But Deb, if we have more questions, we're happy to try and answer them here.
Absolutely. We do have a few more, and if you want to raise your hand on your control panel, we can do that for you as well, or type them in as you have been doing. This one is kind of a loaded question from Rod. With rate adjustments being inevitable in the future, how do you see our commissions being affected now and in the future? So
I don't
get
know.
out your crystal ball.
Yeah, that is kind of a loaded question. I don't know. We'll have to see. I mean, I think
Yeah.
I think the whole market, everybody that participates in this market is going to go through this first open enrollment period, and then we will all come back and we will regroup and we will readjust, and we'll see what happens. I truly don't know. That is a big question mark for everyone, but
absolutely.
yeah, that's the best thing I can tell you. I mean, we're still trying to sort out how this is going to play out.
As we all are. Kim asked if the SBC will be sent to the clients that broker service with their policy information.
SBCs, go ahead, Deb.
Well, no, you go ahead, Scott.
Well, the SBC, as I understand the regs, the SBC has to be made, there are 3 times when it must be made available: at the time of application, at the time of renewal, and upon request. So they'll be available when the client is applying. They'll be out there on the website. As we actually have them out there now. If somebody comes to our website and wants to apply, the SBC is available. It's available to you currently in the broker portal. When you're choosing products for your client, if you're in there entering an app, it's available in there. And of course, they can always call us and request one. And then when we send out renewals, it's available to them as well. They're notified of where to go and find the SBC. What we'll actually send to somebody when they sign up for the plan, we send them a copy of the actual contract, which will have an outline of coverage in it. So they will get benefit detail in the member materials that we send them when they sign up. But the SBCs will always be available out on the website. They'll be you or your clients can go out and get them and pull them down anytime you need to.
And just a note on that, if you utilize URL's data entry team for turning your paper apps into online enrollment, Stacy will send that SBC to you, to the agent of record. So the slides will definitely be available. The presentation is being recorded, so you all get a recording and be able to view this, and also the deck. So a question from Sean: does CBC plan to revisit the pricing? Good question.
I'm sure we will. I'm not sure if we can do it right now, given the fact that these rates had to be filed not only with the state but also with the federal government. But I'm sure that, you know, given the competitive environment that you know is emerging as people dig into the products and pricing that's out there, I'm sure we'll be doing that.
Okay, and last chance to enter your questions. And it looks like we are at the end of the questions. So thank you again to everyone for participating, taking time out of your busy schedules. I appreciate it. I'm sure Scott does as well. If you want to hear this again, you're going to be getting a copy and a recording of it, but Scott is running numerous webinars such as this directly you know, to all Capital Blue Cross licensed producers. I did send that schedule of webinars out in last week's Healthcare Reform Essentials newsletter, and it will be going out again tomorrow. But again, thanks to everyone, and thank you very much, Scott. I appreciate your time in doing this for our agent partners, and you know, we're available for questions.
Absolutely, and thanks for pushing the schedule back out there. We've had amazing response. I've had more people on webinars with this than I think in any other circumstance. So thanks for pushing that out there, and thanks again to everybody for being on this on the webinar this morning. I really appreciate your time and attention, and for the questions too. I think you raised some good issues and you asked some good questions, and stay tuned. We'll keep pushing for answers and trying to get them to you.
Great. All right. Enjoy your day, everyone.
Thanks, Deb.
Thank you. Bye-bye.
Bye-bye.